Hello, my name is Marilyn Green, and I will be presenting with my partner Mackenzie on cognitive behavioral group therapy. And the outline of our presentation will be all about CBT and then the role of group counseling, clients' needs and population. Then we will look into research review and models and modification. So CBT. So CBT was developed by Aaron Beck in 1960, and it was one of the major theoretical approach to group counseling and addiction and mental health in a cognitive behavioral therapy setting. And the concept is based on thoughts influence emotions and behavior, and it is meant to be an intensive short-term problem solving and goal-oriented approach. And it is mostly affected through emotional dysregulation and mental health treatment. And so the cognitive model is based on a situation. A person may experience something and then their automatic thoughts comes in, such as a negative thought of I'm going to mess up. And then their reaction, which invokes emotion, and which could be fear or anxiety. And then the emotion invokes behavior, which is fidgeting. And then physiological response would be sweating. And so basically, Aaron Bach wanted to really focus on the cognitive psychological aspect first to get into a deeper understanding of the behavioral choices of individuals. So CBT. And so what is it? What is it? It's the client learns to identify, question, and change thoughts, attitudes, and beliefs and assumption related to problematic emotional and behavioral reaction. And so that will involve a client to actively participate in learning, to focus on their present thoughts and emotions. The goal is to help them recognize negative thought patterns and differentiate between facts and assumption, and then develop healthier ways of processing those experiences. And so this approach allows clients to take control of their emotions and improve their self-awareness while cultivating coping mechanisms. And that's why CBT is highly effective, is because it allows clients to track their progress through structure techniques and problem solving strategies. And clients can apply these skills in real life situations. And so by that, they're reinforcing positive behavioral changes. And those changes are based on identifying a distortion of thinking, seeing through the idea rather than facts, and then considering the situation from alternative point of view. So what are the benefits? The benefits of group counseling. So in mental health and addiction, group counseling serves as an essential treatment method for individuals struggling with addiction and mental health issues. The group setting provides a sense of support in reducing feelings of isolation and judgment. In this environment, clients share like their experience, emotions, and challenges, helping them build connections and a sense of belonging and unity. And this fosters motivation and mutual understanding as individuals work towards their recovery at their stage. Additionally, group counseling provides access to psychoeducational resources facilitated by trained mental health professionals. These professionals help clients connect and explore their thoughts and emotions in a structured, safe environment, equipping them with knowledge about their mental health conditions and how they could use coping strategies in their real day-to-day life. So it promotes active participation in discussion, and it develops coping skills, problem skills, and self-regulation techniques, and as well as help normalize healthier thought patterns daily. And then group counseling. So the benefits of group counseling is a great, such as like substance use disorder is a great example of how group counseling benefits individuals. And in these sessions, clients gain insight into relapse prevention techniques, share their recovery journey, learn about each other's coping skills. And so exposure to different types of treatment methods and success stories help participants develop positive behavioral changes while identifying their triggers for what they are looking to recover from. And this peer learning aspect strengthens their recovery process and encourages them to a longer commitment to their sobriety. And this is because this provides a supportive environment and reduces feelings of isolation and judgment. Because they are expressing similar thoughts and feelings and concerns and experiences. And as well as we touched on our previous slide, you also clients also get access to psychological educational materials. So when we chose to do client needs and population, we focused on three, and the three were substance use disorder, anxiety and mood disorder, and behavioral challenges in adolescent. So we're first going to look at substance use disorder group. And substance use disorder groups, there is peer insight on relapse prevention strategies and similar experiences, exposure to different treatment plans, and peer coping skills, and behavioral changes through group discussion, influencing behavioral changes and self-awareness, and learning to recognize triggers. So clients' needs and population. So the need for substance use disorder is supportive and therapeutic alliance, relapse prevention strategies, a structured environment to practice emotional regulation. Challenges around this supportive group is that there might be a stigma around substance use, which comes with judgment and challenges in itself within socially and economically and outside of the group, possibly concurrent with mental health disorder as well. Mental health and substance use disorder usually coincide with each other and can concurrently happen. And so challenges may occur that there needs to be treatment plans that is concurrent to addressing mental health and the substance use at the same time. And the anxiety mood disorder, and that is the need is to coping skills and to restructure cognitive thinking and emotional support. And challenges that come from that is difficulty building trust and rapport. And that comes with also a person's thoughts and behaviors regarding feeling anxious and avoiding group settings and group behaviors. And basically they have a difficulty trusting others, or it takes them longer to navigate identifying genuine rapport in a group setting. So they're a bit skeptical. And then the last one is behavioral challenges with adolescents population, the need of validation reassurance. They need guidance in that, a safe space to share emotions, cope with strategies, coping strategies, and conflict resolution. And challenges are not receptive to authority figures. That is very common within youth. Everyone goes through that phase of wanting to find identity to themselves and own up their identity. So they might not be receptive to authority figures. And then impulsive response to triggers. Brains are still developing in adolescent stages. Impulsivity is not fully is the main driver in an individual's adolescent's brain. So that is one of the challenges in when they're presented with a trigger, they would impulsively reply. And then confusion about identity. As I touched about earlier, identity is a major concern for adolescents. They're finding out what they stand for, what they believe in, who they are as a person, and where they fit in society, and also peer pressure. At a young age, in the youth, they are extremely influenced, and so they may feel peer pressure to fit into the group in order to be accepted.
Okay, so next we have the research review. For the research, I looked at cognitive behavioral group therapies for complex grief, for ADHD, and also for social anxiety. So the first study I looked at was the effectiveness of cognitive behavioral group therapy for complicated grief in relatives of patients with cancer. So the aim of the study was to evaluate the effectiveness of cognitive behavioral group therapy in reducing grief, anxiety, and depression in relatives of patients with cancer. We did a randomized clinical trial with 249 patients. Data was collected at 4 points, at baseline, at the death of their relative, 6 months after, and then a year after. They were divided into two groups. They were divided into the cognitive behavioral group therapy and then psychoeducational and emotional expression interventions. Uh, so they had to do 16 2-hour group sessions that were held weekly. They found that cognitive behavioral therapy significantly decreased the complicated grief symptoms by 81%. And so the implication of that study is that it's effective in treating complicated grief. It was more so effective than the psychoeducational intervention, which had a rate of 34% of recovery. Next, we have the impact of modified cognitive behavioral group therapy and social adjustment functionings of children with attention deficit hyperactive disorder and their parents' stress levels. So this study aimed to investigate the potential of cognitive behavioral group therapy to increase social adjustments in children with ADHD symptoms, and they also wanted to reduce the stress of the parents related to the child's behavioral symptoms of ADHD. So the methods that they used were they had a non-randomized clinical trial. They had 20 pairs of parents and a child with ADHD participating in it. They did 3 months of cognitive behavioral group therapy sessions. And in those sessions, the parents developed psychoeducation on ADHD and learned ADHD awareness, while the children learned coping mechanisms and how to identify their triggers. So the study found that cognitive behavioral therapy intervention significantly improved social adjustment in children with ADHD and significantly reduced the parental stress. Next, we have the brief cognitive behavioral group therapy and verbal exposure augmented cognitive behavioral therapy for social anxiety disorder in university students. So this study wanted to determine the efficacy of cognitive behavioral group therapy and verbal exposure augmented cognitive behavioral therapy in reducing anxiety. They did randomized control trials with 41 participants that were diagnosed with social anxiety disorder. All of them were university students. They did 6 2-hour group sessions that were held weekly. They found that the cognitive behavioral group therapy intervention significantly reduced social anxiety symptoms, and that cognitive behavioral group therapy was more effective than the verbal exposure augmented cognitive behavioral therapy, and also more effective for treating social anxiety in comparison to individual cognitive behavioral therapy. Next, we have group therapy models. So cognitive behavioral group therapy it mirrors the approach of cognitive behavioral therapy, just in a group setting. So the focus is to address day-to-day problems, build skills, maintain wellness, and cognitive behavioral therapy is used to treat mood disorders like depression, anxiety disorders like generalized anxiety, social anxiety, also obsessive compulsive disorders, bulimia nervosa, binge eating disorder, body dysmorphic disorder, and substance use disorders, as well as concurrent disorders. So the structure of a cognitive behavioral group therapy session would begin with mood checking. So a counselor will ask the client for their moods at the beginning of the session, how they've been, usually during the week, to track process and changes in mood. Then the counselor and client will review and identify issues that they want to target for the week. They'll set an agenda, and then they'll review homework that was given last week. Then they'll address the agenda and issues that were presented in the agenda using cognitive behavioral strategies. At the end of the session, they're given new homework, the session is summarized, and it will end. So cognitive behavioral therapy for specific disorders. So I looked at specifically anxiety disorders and major depressive disorder. So for panic disorder and agoraphobia, the cognitive distortion is catastrophic misinterpretation of introspective anxiety. So in this case, individuals are experiencing and feeling their inner body and feelings of heart racing, and they are viewing that as something that is catastrophic and something that will explode, which will oftentimes prevent people who have panic disorder from leaving their house in fear of having panic attacks. For social anxiety disorder, it is the root is a fear of incompetence and catastrophic consequences in social situations. So in this case, people will view social situations and social failures as life or death. They'll think that there's going to be extreme consequences for their perceived behavior that wasn't perfect. They see people as having incredibly high standards for them that they can't live up to. And then we have general anxiety disorder, and that's a general struggling with uncertainty and worrying. This is often done as a coping mechanism where you will worry so much you'll end up imagining every scenario so that you're prepared for it. Then we have major depressive disorder, which is characterized by maladaptive thinking and negative appraisal of life events. So it would be an example of this would be someone frowned at you and you're like, therefore they hate me, and just that view. That's even quite literal, but then we have the outcomes of cognitive behavioral group therapy for each of these disorders. So for panic disorder and agoraphobia, social anxiety disorder, generalized anxiety disorder, and major depressive disorder, they are all shown to increase coping skills, while social anxiety disorder, um, specifically in group settings, has higher outcomes in comparison to individual cognitive behavioral therapy. And then we have group modifications for concurrent disorders. So the goals and approach for treating concurrent disorders would be the goal would be to increase self-awareness, self-instruction, self-efficacy, planning, problem solving, and to enhance the sober activities that this person is enjoying so that they'll have more enjoyment in a sober life. The approach would be changing attitudes and skills. So uh, you'd want to focus on self-awareness and relationships with the substance, self-efficacy, so empowerment to feel capable of making a change, and also reduce stress by developing coping mechanisms. So the risk factors for concurrent disorders uh, would be internal, psychological, like like bad self-esteem, self-hatred, and external, which could be the company you're with, the environment. If you walk by a bar and you have a history of alcohol use disorder, you'll probably want to go in, uh, and that can trigger a person to relapse. So also beliefs about the self, negative self-concept, beliefs about oneself, and beliefs about one's relationship to drugs also impacts uh, their risk to relapse. Their automatic thoughts, which increase intention to use the substance because it becomes impulsive. Uh, Cravings as well, permission giving beliefs, which are beliefs that just are like, you can have one drink. Um, and rituals that are associated with substance use and adverse psychological reactions from relapse. So key skills for group therapy, cognitive behavioral therapy for concurrent disorders are coping with cravings. So they'll be given strategies to delay and distract from cravings, cognitive restructuring, which is identifying and changing dysfunctional thinking, developing techniques to decrease substance use, problem solving skills so that they can address problems without using substances, counter negative beliefs, so they challenge thoughts that decrease their self-worth, and also social supports, which can be from group for substance use disorders, could be from the cognitive behavioral group or friends, family, and the community. So conclusion, cognitive behavioral therapy is a structured and evidence-based approach used for treatment of mental health and substance use disorders. It addresses cognitive distortions and behavioral patterns and allows for individuals to develop new skills, resilience, self-efficacy, and long-term coping skills. Providing people access to cognitive behavioral therapy can improve rates of recovery, reduce risk of relapse, and promote psychological wellness and well-being.